But we are here today to release our evaluation on DHS's oversight of personal care assistants. As you may know, OLA completed an evaluation of PCA, personal care assistants, in 2009. And at that time, we found that the PCA program was unacceptably vulnerable to fraud and abuse. I'm happy to report that following the release of that 2009 report, the legislature and DHS made numerous changes to strengthen the oversight of PCA. That being said, based on the evaluation we're presenting today, there are still some opportunities for improving PCA oversight. In particular, a couple things I just want to comment on before I turn it over to Ms. Rodriguez, who was the manager of the evaluation. DHS has allowed the continued use of two different tools to assess whether an individual is eligible for PCA services. And DHS has not determined whether the use of those two tools, the so-called legacy PCA assessment and min choices, DHS hasn't determined whether those two tools produce different results. And we heard concerns about differences from assessors. We also have other concerns that Ms. Rodriguez will discuss. There's one I want to emphasize in particular, and it's related to the Community First Services and Supports Program. This program, it's also CFSS, was established in 2013 by the legislature, and it will replace PCA. But there are important differences between the CFSS program and PCA, and we do think it makes sense for the legislature to review the oversight requirements in this new program and ensure that it still meets your needs and expectations. A lot has changed since 2013. I mean, heck, a lot has changed in the last 3 days, and the requirements in the CFSS program may not have kept pace with the legislature's expectations. So to get into the details of this evaluation, I'd like to now turn to Ms. Rodriguez, who will discuss more in depth the findings and recommendations of our report. Thank you, Mr. Chair.
Sorry, welcome to the committee. That was, not paying attention like you said. Go ahead.
Thank you, Mr. Chair and committee members. For the record, my name is Jody Rodriguez. I'm with the Office of the Legislative Auditor. Before getting started, I would like to acknowledge the other members of our evaluation team, Catherine Tyson and Scott Fusco, who are seated behind me. Personal care assistance is an important program that helps thousands of Minnesotans with disabilities, chronic diseases, and mental illnesses live independently in their homes and communities. It's also a program that presents challenges to protecting recipient safety and is vulnerable to fraud because it's often delivered in private homes without independent supervision. Our evaluation focused on 4 main aspects of DHS's oversight of personal care assistance. First, the assessments that individuals must receive in order to determine individuals' need and eligibility for personal care assistance, the enrollment process for personal care assistance providers, targeted program integrity measures, including fraud investigations, and Community First Services and Supports, which will eventually replace the PCA program. In this presentation, I'll outline a few of our key findings. Then I'll provide a brief overview of the program and go through a few more details on those findings and recommendations. So as Ms. Randall noted, DHS and the legislature have made a number of improvements in oversight of PCA, but we also identified areas for further improvement, and the next 2 slides list some of those areas. First, DHS allows the use of 2 assessment tools, as Ms. Randall noted, to identify individuals' need and determine eligibility for personal care assistance, but it has not evaluated whether the use of those 2 tools produces systematically different results. Second, DHS's initial provider enrollment process has generally ensured that personal care assistance agencies complied with legal requirements, but there is room for improvement in that process. Third, DHS did not take timely action to fully investigate some cases in which preliminary investigation identified issues. And last, Community First Services and Supports will replace PCA in the future, and it has different oversight requirements. So if you allow me to just back up a moment and describe a few basics about PCA. First of all, what does it include? It includes help with activities of daily living, such as dressing, eating, bathing, instrumental activities of daily living. So that would include things like meal planning and preparation. It can help with observation and redirection of behaviors, such as verbal or physical aggression. and it can help with health-related procedures and tasks, such as reminders to take medication or exercises to maintain recipient strength. Individuals that wish to receive PCA must be eligible for certain publicly funded health care programs, such as medical assistance, Minnesota's Medicaid program. They must also receive an assessment through their lead agency, which includes counties, tribal governments, and managed care organizations. The assessor must determine that an individual needs assistance with at least one activity of daily living, or what we call a qualifying behavior. Individuals must also meet other criteria, such as being able to direct their own care or having a responsible party to help them direct their care. And based on statutory guidance, assessments determine how much PCA time an individual is qualified to receive. We looked at data for fiscal years 2015 through 2018, and we found that the number of individuals who received PCA increased in recent years to about 43,700 in fiscal year 2018. And the costs also increased during that time period to just over $1 billion in fiscal year 2018. You can see on the chart to the right that the costs were split almost evenly between federal and state expenditures. Most PCA is paid for through medical assistance, which is offered through a state plan and waivers. The medical assistance state plan paid for about 97% of PCA expenditures in recent years. Minnesota also has two payment models for medical assistance, fee-for-service and managed care. Our evaluation focused primarily on PCA provided through the fee-for-service medical assistance state plan, rather than, for example, the home and community-based services waivers or managed care organizations. So moving on to a little bit more information about our key findings. As we've noted, DHS allows county and tribal government agencies to assess individuals for PCA using two separate assessment tools. One is the paper-based legacy PCA assessment, and the other is a web-based MinChoices assessment. DHS has not evaluated whether these two tools produce systematically different results. A DHS official told us that they use the same eligibility criteria, so they should produce the same results. But the two tools are quite different. If you have our report in front of you, on pages 17 and 18, we have a few examples of the tool. And you'll be able to see that the legacy tool has quite a bit more space for open-ended comments, while the MinChoices tool is primarily composed of closed-ended questions. In addition, individuals with different professional backgrounds and training can administer the two tools. We also noted that some assessors expressed concern about differences between the two tools. We surveyed all certified MinChoices assessors, and we asked them what, in their experience, have generally been the results when they assessed individuals' eligibility for PCA with MinChoices after the individual was assessed using a legacy PCA assessment. More than 40% of respondents indicated that individuals were generally eligible for less PCA time with MinChoices. Less than a quarter said that results were generally the same, and more than a quarter said they didn't know. This is a quote from one of the assessors that we surveyed. They told us that when using the legacy PCA assessment, it was easier to approve hours based on the assessor's opinion, while in their opinion, MinChoices was more standard. DHS has allowed the use of the two tools for more than 6 years now. DHS launched MinChoices in 2013 and rolled it out to all tribal agency and county government agencies in through 2014. But to date, the department does not require its use for all PCA assessments. So it's important to have reasonably consistent assessment results throughout the state to ensure equal access to services. In addition, it can be difficult for individuals whose PCA time changes from year to year based on the assessments that they receive. So we have a few recommendations related to this. First, that DHS should establish a firm timeline for requiring assessors to use MinChoices for all PCA assessments. Now, in Chapter 2 of our report, if you've had a chance to look at it, we do note some concerns that assessors voiced related to consistency of the MinChoices tool, the guidance that's available to assessors, as well as some other things. We also note some concerns that advocates expressed related to the tool. We don't want to downplay those concerns, but we do believe that DHS can mitigate many of the concerns by engaging in a process of ongoing improvement with that tool. We also recommend that the legislature require DHS to regularly evaluate the consistency of assessment results across assessors. We think this could help DHS ensure that assessment results are reasonably consistent among assessors and help guarantee equal access to PCA across the state. So moving on to our next key finding related to enrollment. PCA is provided by personal care assistants who are affiliated with PCA agencies that have specific duties in law. Personal care assistants and agencies do not need to be licensed, but they do need to enroll with DHS. We reviewed DHS's provider enrollment process for agencies that enrolled in fiscal year 2018, and we concluded that DHS's initial provider enrollment process generally ensured that the PCA agencies complied with legal requirements. For example, certain PCA agency staff must complete background studies, and DHS's data indicated that nearly all of these staff did so. In addition, DHS conducted site visits to nearly all agencies that enrolled that year. However, we did find areas for improvement in the enrollment process. For example, 24 of the 93 agencies that enrolled with DHS in fiscal year 2018 had at least one staff member that did not complete training as required in law. In addition, about 180 of the nearly 13,600 personal care assistants that enrolled with DHS in fiscal year 2018 either did not complete training or did not complete it within the required time frame. In addition, DHS does not require PCA agencies to submit all required documentation during initial enrollment, as we show on page 46 of the report. This includes written policies and procedures and templates for the PCA care plan. In addition to meeting enrollment requirements, statutes require PCA agencies to document services provided to PCA recipients. However, state law does not specify how or whether DHS must regularly ensure that PCA agencies are completing this requirement. For example, PCA agencies must keep certain documentation about recipients, including updated care plans and records of supervision visits. DHS told us that during certain site visits, staff do review this type of information, but based on a lack of detail in DHS's policies and site visit reports, it was difficult for us to determine the extent to which staff did check on this requirement. So we have several recommendations in the report related to enrollment. One of them is to ensure that PCA agency staff complete required training and the training required in law. We also recommend that DHS review all required documentation to assure compliance with legal requirements during PCA agency's initial enrollment. In addition, we recommend that the legislature clarify DHS's responsibilities for monitoring PCA documentation requirements. If the legislature wants DHS to be more comprehensive in its oversight activities, we believe it should be explicit in law. So moving on to our third key finding related to investigations. DHS's Office of the Inspector General investigates potential fraud and abuse in Medicaid, including in PCA. When the office receives complaints, they go through a triage process, including a preliminary investigation, which determines whether DHS should open a full investigation. We analyzed investigations data and found that in November 2019, the office had more than 300 cases in which a preliminary investigation resulted in a recommendation to open a full investigation, but an investigator had not yet been assigned. Those cases had been waiting an average of 271 days for assignment of an investigator, and a few of the cases had been waiting up to 2 years for assignment. So we recommend that DHS develop a plan for investigating suspected fraud and abuse cases in a more timely way and present that plan to the legislature for review. So last, our evaluation was focused on PCA, but it's important to keep in mind that the program will be replaced in the future by community first services and supports. The 2013 legislature established that program, but it did not require DHS to implement the program by a certain date. The department recently set a target date of July 2021 for implementation. The programs are similar in many ways. So for example, in both programs, individuals must receive assessments in which they're determined to need assistance with at least one activity of daily living or one qualifying behavior in order to be eligible for the program. Each of the programs also have 2 service options for recipients to choose from. But the oversight required by CFSS is different in several ways as well. So for example, in PCA, qualified professionals who are registered nurses, mental health professionals, and other qualified individuals must visit all recipients to oversee PCA at regular intervals. CFSS does not require direct oversight by qualified professionals. It does have other oversight mechanisms. So for example, individuals in one of the 2 service options must have their services regularly evaluated by the agency they've chosen to provide those services, but statutes don't specify qualifications for the individuals that conduct those evaluations. The legislature passed CFSS in 2013 and has not made significant changes to those statutes since 2015. It has, however, made a few changes to PCA, including requiring qualified professionals to enroll with DHS. That may indicate that the legislature has changing opinions about the type of oversight that these types of services require. So we recommend that the legislature review the oversight requirements in CFSS and determine whether they still reflect the legislature's priorities. So thank you for your time and attention. We have a number of other recommendations for the department, which are on pages 95 and 96 of our report. But at this time, I'd be happy to answer any questions if you have them.
Well, thanks, and maybe just to keep time going here, maybe we'll have the commissioner, or whoever's going to respond on behalf of the department, and then we'll have you all come up in some spread out way. And this social distancing thing is really kind of weird, isn't it? It's like necessary, but anyway. Well, welcome to the committee. So keep your distance. Stay back over there. Who's going to go first?
I am.
Welcome.
Good afternoon, Mr. Chair and members of the committee. For the record, my name is Gertrude Matemba Mutasa. I am the Assistant Commissioner for the Community Supports Administration at the Department of Human Services. The Community Supports Administration includes Disability Services, which oversees the Personal Care Program, otherwise known as the PCA program. Thank you for extending an invitation for DHS to respond to the Office of Legislative Auditor's evaluation of the PCA program. We appreciate the time and professionalism that staff at both the OLA and DHS have invested in the evaluation of this critical service. Overall, we are pleased with the results of this evaluation and look forward to implementing many of the recommendations detailed in the report. DHS is proud of the strides we have made in overseeing the PCA program over the past decade. The PCA program has long been a flexible option in the continuum of care servicing people with disabilities, older adults, mental illness, to live independently in their communities. Without this program, the lives of Minnesotans would be fundamentally impacted, and in some cases, lives would be at risk. The PCA program served 44,000 people in 2018. We anticipate continued program growth as demographic shifts materialize and people opt to live in their homes, participate in the workforce, and all aspects of community life. The PCA program is the driving force that allows 73% of Minnesotans with disabilities to live in their own homes. Audits such as these are an important trail marker in our efforts to implement program integrity measures while also ensuring the service remains cost-efficient and accessible. Many of the recommendations made by the legislature after the 2009 OLA report have been implemented and operational for many years. Just last year, at the request of CMS, the DHS Provider Enrollment Team presented at the National Medicaid Provider Enrollment Conference on the procedures in place in Minnesota to enroll PCA providers. In the area of investigations, we have more than doubled the number of PCA investigations between 2017 and 2019, with more than 60% of investigations completed in 2019 on PCA providers. We continue to strengthen program controls, including launching an electronic visit verification system and additional reviews of our assessment and documentation tools in the coming year. Still, there is room for improvement in our systems and processes. We cannot emphasize enough the critical importance of PCA and the continuum of services that help people live full lives in their communities. As PCA has been growing, so too has the workforce shortage, posing many challenges for people using PCA. While we support continuous improvement efforts, we are concerned that in some cases, additional requirements could make it more difficult for people to find assistance and for providers to stay in business. The PCA program was designed to be a cost-effective alternative to more expensive settings such as nursing facilities, corporate foster care, and care facilities for people with developmental disabilities. Some of the recommendations in this report expand oversight in a way that would be more appropriate for a licensed service. PCA is intentionally unlicensed. Shifting toward a licensed model could compromise the character of the program that makes PCA so valuable to the people using services. We are ready to work with the legislature to find the right balance of regulatory oversight that allows PCA to remain a flexible option for Minnesotans across the state. Thank you again for the opportunity to comment. And joining me is my colleague, Matt Anderson, Medicaid Director and Assistant Commissioner for the Healthcare Administration at DHS. We are both happy to stand for questions from members.
Thank you. Do you want to say hello, or do you want to just stand for questions?
Hello to the committee and Mr.
Have you been before us before?
I have, in other capacities. I'm new at the department.
Right. Why don't you just say hello to us in that capacity then?
Okay. Well, good afternoon. Thank you for having me. My name is Matt Anderson. I'm, as Gertrude said, Assistant Commissioner for Healthcare Administration and the state's Medicaid Director. I joined DHS about 4 weeks ago. Previous to that, I spent 14 years at the Minnesota Hospital Association, overseeing policy and strategic affairs.
Well, good to have you here. I have just a comment and a question maybe, and then we'll take some other questions. And so the ongoing challenge of the reliability of the assessments as a term, not as just, is it reliable? Do we trust it? Continues endlessly, and it's a function of training and the complexity and all that. So I'll just make that as my, how many times have I said that? I don't know how many times, so I'll just mention that. And so I don't know which one of you wants to comment about the state of the OIG and how the fraud investigations are going. I would like to have you tell me that the 271 days is way old news and we're down to about 12. So
Okay.
Do you want to comment, please?
So my colleague Kalani is here.
Yeah.
And she's going to respond to that question.
Thanks. Somebody can just do musical chairs there. And
Thank you. My name is Kalani Mote. I'm the Interim Inspector General with the OIG at DHS. Yes, and what we're doing is we're taking what we have learned in our continuous improvement project with our CCAP investigations area and taking the tools that we have gained from there and the efficiencies that we have learned, and we're going to be applying that to our provider investigations area so that we can continue on working and getting that number down so that it doesn't take 271 days for our investigators to take on a case.
sure. And what's the current number? Is that a current number?
I'm uncertain as to that current number, but I can get back to you with that information.
Yeah, and one hearing we never had that I wanted to have, and frankly, in this environment, everything that's not like the house is on fire is suddenly, more challenging to even take on. And Good news for you, if you're worried about us scrutiny to this report, there's so many other things going on, but we did want to do due diligence and have you come. But one thing we wanted to have, and we still may before we get out of here, depends what April looks like, is just to have an update on how things are going at the OIG. And I was one that was very concerned and offered all kinds of relatively loud thoughts. And so, but in a way that I was hoping it would just get better. And so I can't wait to hear that. And maybe just even in the interim, you'd like to prepare a report for what you would say to us if you were going to meet. It could be like a virtual report, and then we could publish that to people in this virtual world. So, other questions? Senator Kiffmeyer, did you have a question?
Thank you, Mr. Chair. So I was doing a quick review of the report, and especially the responses from Commissioner Harpstead, which were encouraging, taking each one of those things and giving a date, responding to them, which is a very management style of doing things. You manage these things. But one area that I have a question about, and I'm just going to read from page 92 on the very bottom. It says, under federal law, states must require that PCA providers use an electronic visit verification system by January 2020 or receive a decrease in federal Medicaid funding. Minnesota received a one-year delay in the reduction of federal funding, but DHS has yet to implement such a system. In this chapter, we noted the 2013 legislature established CFSS to replace PCA, but we're 7 years later and not enacted, and so on and so forth. But probably, Mr. Chair, the biggest situation for us, we already received a one-year delay in the reduction of federal funding. And so where are we at on that? Are we still at risk? I would think so. From this, I know we're in kind of an unusual circumstance right now, so they'll probably push most everything a little bit back, but still, nonetheless, decreasing federal Medicaid funding is a pretty serious thing and is usually a large amount. So if you could respond to that.
So whichever, yeah, go ahead.
Sure. Mr. Chair, members of the committee, I would start out by saying that the EVV program initiative is a very challenging one for almost every state. 49 states actually filed for this extension, and we were one of them. There are a couple of issues, just to come and maybe start off high level, a couple of issues. The first issue is that there are very few companies that are able to create a statewide EVV system. That's one of the issues. There's another thing. The second thing is that in the few cases where the program has actually been launched, it has not been very successful. So what we're trying to do now is to figure out, in this competitive climate of only having a few providers, how do we get in front of the line to be able to meet that 2021 deadline? And it is definitely a priority for DHS as we're working and learning from other states as well, what they're doing to try to launch in a timely manner.
Senator Kiffmeyer.
Thank you, Mr. Chairman. So is this something that you have worked with the Minnesota IT to evaluate the needs that you have, to evaluate the companies that are available? If you could respond to that.
Yeah, sure. Go.
Mr. Chair and members of the committee, yes, anything that's technical in nature like this would be something that we would get advice from Minnesota IT.
Senator Kiffmeyer.
Thank you, Mr. Chair. So I would say what it sounds like right now, you're looking for more of an off-the-shelf, some software that's been written maybe in another situation. One of the things I was wondering about, since this is in all 50 states doing, has there been given any consideration to a consortium of states working together to develop an electronic visit verification that could be used by maybe more than just Minnesota?
I'll make a note of that and get back to you with
And
more
we
detailed
spoke about
response.
this. Senator Kiffmeyer, I remember that when we were working on this, we took a savings for doing this, which must magically vaporize in the forecast or something. Cool to have that kind of magic. But there were vendors who had actually worked out some of this, and the issue was a statewide one compared to letting people get their own. And I think I expressed concerns a bit before your time, but or your time either. But I was concerned about how this might go, and anyway, so I don't want to dig into it too much today. We have this other emergency matter to deal with. But so it's on our minds, and I really appreciate bringing that up and finding that detail in the report. Senator Ralph, and then I think we're going to move on. So, go ahead.
Thank you, Mr. Chair. I just have a quick question for somebody here, and that is, I've noticed that there's several deficiencies, the record keeping for one, that the auditor has discovered. And I am concerned, just as in the case of the electronic verification, are there any of these other deficiencies that were identified such that it could also put the federal programs in jeopardy in terms of compliance? And I wonder if you're aware of any additional areas that really need to have some close look at before deadlines arise, or before the federal government comes back and says, well, you haven't done this, and now we're going to do the same thing and reduce funds.
Mr. Chair and members of the committee, the report we felt was very thorough and was able to highlight some of those high-risk areas. So we feel like it was pretty comprehensive.
Yeah. So we'll dig into this some more. Just to reiterate, the ongoing challenges of reliable assessments and the program integrity, it's on our mind. The EVV is a way to try to fix that, and we're trying to be part of your support team here, but on it goes, So anyway, I appreciate it. Welcome to the department, and thank you for all your good work. We're going to switch gears now, and we have some people that would like to, and it's just really too bad. I would like to have spent more time digging into that, and but these, Mr. Griffin, who else is going to testify about this? Maybe if two of you want to come down, and we have room for two, sorry, not room for three, so draw straws or something. I've heard a lot about the concerns about what is going to happen at some of the day training facilities. And given the numerical count there and, the inability to socially distance, you can come down, Ms. Noren, if you're coming, or whoever. But oh, you're together. Okay. Anyway, it seems that some of those places are going to have a hard time staying open. And if they are half open, what does that look like? And when the people are taken from, the DTNH is closed, they go to the group home, there's no staff there. And so I really think that some of these folks are in harm's way, and I'm very concerned about it. We do have a proposal we're looking at to give the commissioner some authority to juggle through all this. And so at least we're going to talk a bit about some of those challenges today. So Ms. Noren, are you going first, or are you waiting for Mr. Griffin to get back? Hey, Mr. Griffin. You going to go first?
Happy to, Mr. Chairman. Mr. Chairman, members of the committee, my name is Phil Griffin. I'm a lobbyist with Ewald Consulting, speaking to you today on behalf of ARM. ARM is the trade association representing 200 home and community-based services providers, organizations supporting over 30,000 people with disabilities in the state of Minnesota. Our members are growing increasingly concerned about their ability to meet the needs of the people they serve every day if the COVID-19 virus takes hold in the way that some are predicting. We are requesting that the legislature grant regulatory relief and financial assistance for those with disability service providers who are affected by the COVID-19. The impact of this virus on disabled in Minnesota could be immense. Imagine what would happen if a day training and habilitative program suddenly shuts down due to the virus and is no longer able to support hundreds of people with disabilities during the day. The residential service providers would be faced with finding staffing to support those individuals. This would be a big lift in normal circumstances. However, it's even more challenging given the staffing shortages and crisis that we are currently finding ourselves in. Additional resources would be required to support new hires, pay for overtime of those who are able to pick up extra shifts, purchase of additional supplies, etc. We are also anticipating that many of the direct support professionals that we have working now will be affected by the virus, and this will also add to the crisis for staffing homes for people with disabilities. We respectfully request that additional financial resources be made available for residential service providers so they can continue to support individuals with disabilities. We thank you for this opportunity to speak today, and Mr. Chairman, this was written this morning. The prediction came true. We've now learned that there are facilities that are closing their daytime facilities, and we are faced with exactly the scenario that we put before you today. As I said, the need for both financial and regulatory relief is something that we would appreciate, and we look forward to working with the committee. I understand from the chairman that there are bills proceeding, and we will see language today to begin that process, but we think this is only the beginning. Mr. Chairman, members, thank you again for the opportunity. If there are questions, I'd be happy to address them, but Ms. Noren is here as well.
Yeah, so I guess it's helpful to first talk about the problem, and then we'll see about a solution. We do have a draft that's still warm from the copier that we're going to be discussing momentarily. But so, Ms. Noren, go ahead, please.
Mr. Chair, members of the committee, I'm Lynn Noren. I'm the president of RISE Incorporated. We're a provider of employment and day services to people with disabilities pretty much throughout Minnesota.
And my name is Julie Johnson, and I'm the president of MSS, another metro-based provider of disability and employment services for Minnesotans with disabilities. We are presenting this testimony today on behalf of MORE, the statewide association representing a vast majority of disability and employment day service providers across the state of Minnesota. As a statewide association of providers that supports thousands of Minnesotans with significant disabilities each and every day, as you can imagine, these are incredibly uncertain times for us. The leadership teams of our membership organizations across the state have been meeting continuously since the scope of the coronavirus became clear and have been making decisions about how to best move forward. The most crucial factor driving these team decisions in each organization is how to best support the physical and mental health of adults with disabilities that we serve. That will continue to be the driving factor in our decision in the coming days, weeks, and months. That said, making decisions to deliver services in these uncertain times in a way that will best support the physical and mental health of Minnesotans with disabilities we support will require us to deliver services in ways that may be inconsistent with current regulations and will most certainly result in devastating financial losses for service providers. Many day service providers are already closing due to the guidance from the Minnesota Department of Health, and people with disabilities should not be congregating in groups of 10 or more. This is currently happening without any guidance from the Department of Human Services, leading to great uncertainty and potential breakdown in our system. While we understand that state agencies are furiously working on mitigation responses, and we have shared our priority items with DHS, we will continue to be in communication with them throughout this process. Because of this, we respectfully request that our legislative partners and our DHS partners move forward on steps that have been identified that will provide the necessary coordinated state-level guidance, the needed regulatory flexibility, and the crucial emergency funding. Swift progress on these items is our best chance of protecting the people we serve and preserving the short and long-term infrastructure of our state's disability and employment day services. The time is of the essence for providers to receive this crucial guidance and the necessary funding to protect our most vulnerable citizens. Thank you very much, members of the committee and Mr. Chair.
Mr. Chair, members of the committee, we wanted to provide a brief summary of some of the requests that were sent. We did copy this in an email to both you and Senator Hoffman of the regulatory accommodations that we're seeking.
Please do.
You want to go through that? Okay. So those that are of a high priority, we can kind of put them in two different areas. One is regulatory and administrative, the other is emergency funding relief. We would like to confirm staff of disability and employment and day services providers qualify as emergency workers for the purposes of the Governor's Executive Order 2002, and therefore their children can access school-based care. We would also like to allow disability service staff to be shared differently between different disability service types so that providers could subcontract with each other and share staffing. At RISE, although we are closing our day service sites, we reached out today to 6 different residential providers. We have agreements in place to share all of our staff team members, DSPs, with their homes to get through this difficult time. We need to expedite background checks for this. One example with that same example is that all of our staff, of course, have a background check, but they're location-specific in statute. And so we want the flexibility to be able to waive that and have them be able to work in the homes immediately. Allow someone to keep access to their waiver, even if they are in the hospital setting exceeding the allowed number of days. Create an exception for individuals on MAEPD who are unable to work for some time due to the fact that the business they work for would be temporary closing, and we don't want them to lose those benefits that are very important to them. Coordinate and increase access to necessary medications and supplies and personal protective equipment for people with disabilities. Give disability providers priority status for accessing these items. We'd like to waive the training requirements on company-specific policies and procedures, allow for delay in the 45-day or annual meetings until we can get all necessary people involved to be able to attend those meetings, allow flexibility in the timelines for specific trainings. For example, maltreatment training coming up in a month, we might need some flexibility in the timelines there. Allow employment and day service providers to be provided to someone in their home or group home by their employment or day service provider. Create flexibility in staffing ratio requirements. And then the second area of request is related to emergency grant funding. We'd like to see funds that can be accessed by disability service providers who will be put in a financial situation which forces them to consider that they close or creates a situation where they would not be financially viable to reopen due to their inability to bill for services. This would create instability across the state. Create a pool of funds to be accessed by disability service providers that have temporarily closed down to allow them to have a bridge to fund for their staff to avoid further stressing our critical workforce shortage. Funds to be accessed by disability service providers who incur very high unemployment costs. Many of our providers are self-insured for unemployment, and so that's going to be a steep cost to be able to cover at the time you're not billing for any services. Funds to be accessed by disability service providers for overtime wages, should this become necessary to maintain safe staffing levels. Funds to be accessed by disability service providers to offset the increased costs of personal protective equipment, and funds that could be accessed by disability service providers to pay staff higher wages, should this become necessary to solve a severe staffing shortage. Thank you. Any questions?
I think that's one of the longest shopping lists I've ever heard you say, and I'm just grieving, actually, at what I can imagine the impact is already and is going to be. And that's why we're here today. And some people thought we shouldn't have this hearing, but I thought we better. And so we're going to discuss that. I think just to get things in order, Senator Hoffman will move Senate File 4200, and then the A1 amendment. And there's an oral amendment. Do we know that, or do we need? Okay. Sorry. Mr. Hauswald, welcome to your new corner there.
Mr. Chairman, the oral amendment, Senator Abler would move on page 2, line 4. Page 2, line 4, delete 625 and insert 626.
So thank you. And Senator Hoffman will move on page line 2.4, delete 625 and insert 626. And he can incorporate that. So that's amended now. Okay, and Mr. Hauswald, I know you're busy, but do you want to go through this for us? Do you want to do it from there? You can do it from wherever you like. So back of the room or?
Mr. Chair, members, I can provide a high-level explanation, and perhaps the department would would be able to get more into the weeds on this, but
So let me do a preamble first. And so this is a very young amendment. It was an idea last night as I had talked to the commissioner, but they've been working on this for some time on their own, and kudos to them. And Senator Hoffman and I have been on, and many people, it's been on our mind what's going to happen, and just the tragic news about how it's already going. But and so there was a draft brought to us sometime after 1, and actually at 2, I think, is when then we sat down on a conference call and sorted out some language. And so there still may need to be some edits here and some thoughts, but there's a couple of key parts. One is it gives the commissioner a tremendous amount of authority. Temporary emergency authority is the term we're using to make the system work. And I hope it's, I mean, it's really inclusive. And I think everything you said, Ms. Noren, except for the money part, may well be here. And if we forgot something, we'll see if that's something we wanted to include. It even goes so far as actually some economic supports and beyond that into the realm of the DHS. It attempts to keep the framework that we have, capable capable staff, cared for individuals, flexibility on ratios. And so child care providers could have flexibility on the ratio where the commissioner willing to extend that with all these new array of school-age kids going to be landing in the system. Where are you going to put them? A child care center loses their qualified teacher, they would have to close. And that's not our intention. And so those would be done in some way that the commissioner would then allow for, and which would be then informed to us, and there would be a kind of a close connection with the legislature and this. And I think it's a pretty good balance. And understanding the shortness of time and the smallness of this lifeboat. This is a pretty full lifeboat full of items. And so, but I think it, in summary, could really make a difference in the industry. And I do have to say there are a few commissioners I would want to give this much emergency authority to, but the one we have is one I would like to give that to. So Senator Kiffmeyer.
Thank you, Mr. Chair. Those are really good things to hear. Does this include such as day training and habilitation, DT&H? Many times group homes, their clients are staying home and not going out to those work-type centers. On the other hand, many of those same staff are very knowledgeable about those clients, and sometimes they need extra help in the group homes to cover some of the hours and things. Is this going to enable the commissioner to have the ability to work those things out? Because we do have people willing to work, but location may be more the issue than some of the other regulatory stuff. Could you just respond to that, or maybe DHS could?
Yeah, well, actually, I think we need to clear you all out, so.
Mr. Chairman, if I might just add quickly, that's the exact kind of relief, Senator Kiffmeyer, Mr. Chairman, that we're asking for. And I mentioned it, but I have an email that I just received from one of our providers in Greater Minnesota who said he's heard from 3 vocational/day programs who plan to suspend their program starting on Wednesday, and he's trying to figure out what to do. So we appreciate what the committee is doing here today. We want to thank the department for working. They have been working with us all weekend long, but I can't express to you how quickly we need to move on these issues to be prepared.
Right. And so so I think we'll have Mr. Hauswald go through that. If Representative Albright would like to join us at the table.
Thank you, Mr. Chair.
Senator Jensen and Albright.
Mr. Jensen, Mr. Chair.
Yeah, they're just. If actually Representative Albright would like to join us at the table, he's welcome on behalf of the other body.
We take a vote on that?
He's invited to come in. If you could keep him company and teach him.
Could we take a vote on that?
Yeah. So if you'd like to, you're welcome to sit next to Senator Ingebrigtsen at your own risk, Representative Albright. Anyway, so, and so maybe, Commissioner, who's going to speak on behalf of the UL? Do you want to come up here? And okay. And good. So Mr. Hauswald, so we have ample time. So Mr. Hauswald, if you want to go through it, and then we'll ask questions, and eventually we intend to vote this out in whatever form it's done in. So, Mr. Hauswald, thank you for your due diligence and your very busy early afternoon.
Mr. Chair, members of the committee, we'll just take the Amendment 1 subdivision at a time. Subdivision 1 is just the general grant of temporary authority during a declared peacetime emergency. That authority would take place specifically upon the declaration of a peacetime emergency relating to either a potential or actual outbreak of COVID-19. And then finally, in lines 1.13 to 1.14, the temporary authority expires up to 60 days after the declaration of a peacetime emergency would expire. Subdivision 2 is similar to subdivision 3, and these are the substantive areas in which the commissioner is granted this temporary emergency authority. And I believe these subdivisions are drafted in such a way that tries to capture the scope of statutes that would touch on the line items in each subdivision. So it's meant to cast a wide net, but only apply to those pieces of subject matter that are expressly named in those subdivisions. The identified subject matter then would permit the commissioner to either waive or modify the requirements in those sections beginning on the date of the declaration of an emergency, or of the peacetime emergency, and any waivers or modifications must then be posted on the department's website. Moving to subdivision 4 on page 2. This subdivision requires the commissioner to provide written notice to the chairs and ranking minority members in the House and the Senate of the committees overseeing the Department of Human Services. The notifications of either modifications or waivers must be made no more than 48 hours after the modification or waiver goes into effect. And then if 2 or more of the chairs of those committees were to submit a written objection to that waiver or modification, the commissioner then has to cease all the activities taken to implement that waiver or modification. Chairs that submit objections are allowed to withdraw their objections. And then finally, subdivision 5 requires the commissioner to provide a report to the legislature by January 15th next year with the details about which statutes or rules were waived or modified under this temporary grant of authority. This section would be effective the day following final enactment and then would expire upon submission of that written report in subdivision 5.
And so it's, we sorted through this quickly, the various laws and sections that were allowed to be suspended, as well as the details. So subdivisions 2 and 3 are really important. Commissioner, I just have a question for you. I had mentioned the child care ratios. Under this language or under current law, are you allowed to allow, say, a licensed home to have 18 children, like the school age, if you add into that? Is that something you could allow? So, good to have friends in the audience. Welcome. Welcome back.
Mr. Chair and committee members, currently the staffing ratios for child care centers and family child care are in rules, so this would cover this, allowing us to be able to modify the staffing ratios for child care as well as for our other licensed area, because the majority of those are sitting in rural right now.
So the answer is yes, it
Yes.
would? Okay. Good. Senator Aki?
Thank you, Mr. Chair. And along those same lines, as our earlier testifiers had given us our list, and I just wanted to ask whether council or if you, the current commissioner and stuff can help us, but the background checks, they asked about if they could be transferable to locations. They would have their background check already in place, but need to do it for a different location. Is that included in this, or is that something that you can do quickly?
Mr. Chair and committee members, yes, that would be included in line 1.21 and 1.22. The Background Studies Act is Chapter 245C. That would, giving the commissioner the
Mr. Chair,
by that, we would do that.
we need the microphone to be much.
Oh, yeah.
Much
We
closer?
want to hear you.
Okay. I'm sorry. I will do that again. I'm so sorry about that. So in lines 1.21 and 1.22, that gives us, the commissioner, the authority to modify specific things in 245C. It would exclude the disqualification standards and criteria, so those standards and criteria will remain in place, but some of the specifics of how it is in our system and locations and things like that, she would have that authority to be able to make those modifications.
Senator Rutke.
Thank you. That was what I was asking about.
Other questions? Senator Kiffmeyer?
Thank you, Mr. Chair. This is a smaller thing, but it's been reported to me that there are 3 brands of wipes that can be used for disinfecting in daycare centers, home or otherwise, and they're actually brand names, they're out of them. So the question is, why a brand name? Why not specify must do X, Y, Z, but otherwise, maybe that's not exactly right, but just respond to it, that would be helpful.
So is that covered too?
Mr. Chair and committee members, yes, this would also give us the authority to do that. I can't say as to why that specific brand names are in there. It has always been our intent going forward not to get that specific because of these problems that could arise, but this would give us the commissioner the authority to be able to make those modifications.
Senator Kiffmeyer.
Thank you, Mr. Chair. And even sometimes the most simple things of using regular bleach in a ratio specified by DHS, which is inexpensive and can be used to sanitize areas and do some very good things on bacteria and viruses, that we can be creative here and not be so stuck on something that has to be purchased in a way in a store that makes it incredibly difficult to comply with.
So I guess that's a comment, or did you want a response? Senator?
No, not necessarily, but
Right.
Is that possible? Could you do something like that?
Go ahead.
Mr. Chair and committee members, yes, and we are already working on what things that we would need to be requesting modifications on or changes on that. So the licensing division has been working hard at putting that together. So as soon as this gets put into place and passed, we would be able to move and act very quickly.
Thank you.
Commissioner, did you want to offer a comment?
I do have testimony whenever you.
Oh, you do?
Yeah.
Go ahead.
Okay.
Then we'll go back to this. So
It may answer some of these
it's
questions.
kind of yeah, so we're interested in what you think.
So Chairman Abler and committee members, as you all know, DHS oversees services and healthcare coverage for over 1 million Minnesotans. We've been talking for weeks about what the spread of the COVID-19 virus would mean for those Minnesotans and the service providers who support them. As the governor declared an emergency last Friday, we were in high gear thinking about flexibilities providers would need and taking hundreds of questions from around the state to inform those flexibilities, as you heard from the previous testifiers. We also checked our legal authority to flex regulatory, administrative, and program requirements and found that even the governor's emergency authority does not give the Department of Human Services the authority to flex the many rules we have embedded in state statute versus simpler ordinances and procedures. We're getting calls from across the state, such as, can providers use telemedicine when not currently allowed? Can substance abuse counselors be paid for holding smaller group sessions than normal to allow for distancing? Will licensing allow residential providers to house residents in new unlicensed settings to separate healthy from unhealthy residents? Can licensed childcare providers accept a few more kids out of ratio? Can employers licensed to provide employment and day services for people with disabilities also provide services in group homes if it's necessary to close their day services sites? We spent the weekend crafting this now amendment to Senate File 4200, which is before you, asking you that do you grant the Commissioner of Human Services emergency temporary authority in order to preserve access to services and protection of health throughout the COVID-19 outbreak. This authority would be in effect immediately and run until the governor's declaration of a state emergency comes to an end, at which time we would oversee a gradual, orderly return to normal statutory requirements over a 60-day period. Throughout this emergency time, the bill calls for us to be in regular communication with the chairs of the House and Senate committees overseeing the Department of Human Services and to bring them full disclosure of all rule changes we've allowed. They have an ability to reverse our changes. It also calls for us to make a full report to those chairs and ranking minority members following the conclusion of the emergency status on the state statutes and rules waived under the powers granted to the Commissioner in response to the COVID-19 outbreak. Our leadership team is working right now and through the evening tonight to craft the list of rules they see as having the biggest impact on supporting 1 million Minnesotans to stay safe and healthy in 2020. More to follow after that. Of course, some of the requests for flexibility will challenge federal regulations. We're in communication with the Centers for Medicare and Medicaid, who has a process for reviewing requests. They appreciate the need for state flexibility, and from what we've heard so far, federal flexibility is also likely to be granted for our requests, but that process is fluid and evolving. As this rapidly developing and unprecedented emergency continues to unfold, we also may well need additional flexibility as providers raise questions and concerns. But for now, we ask for your support for this amendment to Senate File 4200. I would like to take advantage of the moment just to tell you, in answer to many other questions we have received, the DHS is not shutting down. We're preparing to work remotely and to continue our support of services and distribution of payments for our regular services throughout this period. DHS staff and I are happy to continue to answer your questions.
Thank you very much. We've got a list. Senator Ralph, then Hoffman, then Ingebrigtsen.
Thank you, Mr. Chair. Actually, I believe the commissioner at least touched upon the issue, and that was the question of how this temporary suspension of rules, I'm sorry, and the more flexibility would impact CMS. I was very concerned that we want to make sure we don't do something that down the road we later find it turning around and biting us where we don't want it to bite. So thank you for at least the awareness there, and I don't know how much we can do here, but I just wanted to raise that question. Thank you.
We're trying to do what we can, Senator Ralph. Senator Hoffman.
Thank you, Mr. Chair, and Commissioner, thank you. I had a whole list of questions, but just by you highlighting what I believe would be embedded in that flexibility, i.e. staff qualifications, background studies, age distribution restrictions, teacher training, orientation requirements, all that stuff that's embedded in there, it sounds like we are all going to give you that temporary flexibility to kind of set aside those state statutes and state rules. So good job. And thank you for caring about, this is the reason I'm here is because this is about the 36,000 people with disabilities that are getting those services, the 1 million plus people that are counting on our response here to give you the flexibility. Let's make this a priority, and I appreciate you doing that. So with that, how are you going to make sure that what you guys know as information up here gets bedded down to those local licensure people, just to make sure that everybody's on the same page and the boats are going in the same direction? Because I don't think you missed anything in this, and if we did, it sounds like you're flexible to add to that, correct?
Correct. So, Mr. Chair and members, we are setting up a frequently asked questions on our facing public website, and as we make changes and offer possibilities and flexibility, we plan to post everything there. We are also, we have all of our normal provider, county, tribe, hotlines and approaches to answering questions still up and running. And we also are participating in the state's SEOC hotline, so that we'll have some DHS people there, so that when people just call in general about COVID-19 questions, there'll be DHS people there to answer DHS-related questions. And so we have plenty of avenues for pushing out and then posting these kinds of things as they come up. And as you know, the bill requires us to post any changes that we've made.
Thank you. Senator Ingebrigtsen.
Thank you, Mr. Chair, and I do have a couple of questions. I was under the understanding that this amendment did not, and maybe staff can help me here with page 2, line 3, where you see 253D. Now, it's hard for you guys to believe that I don't know all these chapters here, like Senator Hoffman. But I do know that part has something to do with the civil commitment treatment of sex offenders. Can you give me a little insight of how that's going to work? I appreciate the fact that you're going remotely and staying in touch with the folks that we all represent.
Just a second, Mr. Hauswald, the other draft had a reference to sex offenders, which we took out of the draft, and so is that an artifact? So is that something?
253D is what the information I have is sex offender civil commitment.
Mr. Chair, Senator Ingebrigtsen, the way that the subdivisions 2 and 3 are both drafted are, they list chapters that may touch on the more specific subject matter that are in the items listed in the lists that follow that longer list of statutory sections. So the fact that 253D is included in subdivision 3 is limited by the phrase "that govern" and then the list of the particular items. So if there is a provision in 253D that deals with the sex offender program or civil commitment, those would not be included to the extent they do not fit the description that's more specific in the listed items from lines 2.5 to 2.18.
I guess
Senator Ingebrigtsen.
I certainly understand that. The other thing I have a question with the commissioner would be on the 1.14 of the amendment relating to the 60-day declaration. Can you apprise me of Chapter 12? And does not the governor have these emergency declaration powers already?
My understanding of the governor's emergency authority does not extend to rules in statute. It extends to rules and ordinances, something lower in impact than state statute. And we needed this authority because so much of DHS regulation is actually in state statute.
Senator Ingebrigtsen, I know you had and our expert from the House is
I do.
more concerned sitting next to you there. But
I could defer that to him. I know he's had extensive experience in this area and very well read. And
so
normally I don't talk like that about a House member, but if I could have Mr. Albright comment.
If you had to have a House member here, that's the one I'd want to have. So, Representative Albright, would you like to offer a comment, please?
Mr. Chair, I understand that we live in very extraordinary times, so I appreciate the invitation to sit upon the dais, but also to ask some questions pertinent to the Commissioner. Commissioner, you're, I'm sure, well aware of the Federal Declaration of Emergency Act from just a few days ago, in which the President instructed both the Secretary of HHS as well as the Secretary of CMS to waive a number of rulemaking as well as credentialing. How would that impact some of the provisions that are held in this amendment?
Commissioner.
Mr. Chair and committee members, I'm not sure, because these things are very fluid, but I would guess they would make things simpler. It would be helpful where any of the emergency changes that we would like to make are challenging federal regulation. If there was flexibility at the federal level, we could make them more quickly. That would be fabulous. But we're not exactly sure how all of these systems changing at the same time will intersect with each other.
Representative.
Thank you, Mr. Chair. Commissioner, in light of that answer, would it not be a fair statement to suggest then that state rulemaking with regard to our healthcare system is subordinate to the federal mandates that were announced just a few days ago?
Commissioner.
Mr. Chair and members, that's generally the case.
Representative.
Thank you, Mr. Chair. Commissioner, on line 1.14, with relevance to what Senator Ingebrigtsen said, why is it relevant or necessary to extend for 60 days the temporary authority granted in this amendment a full 30 days longer than what is outlined in Chapter 12?
Commissioner.
Mr. Chair and members, I think that's in there basically because the way we're standing this up so quickly and moving through this time, we're not sure what the consequences would be of suddenly cutting off services and changes that we've made, and we need to examine that as we reach the end of this emergency and move as quickly as we can back to regular statutory authority.
And I think it's helpful to minimize the disruption as well, because a lot of these places don't turn on a dime. And if you give a waiver for someone to be gone because they're sick, and like a teacher creating a ratio issue with a child care place or understaffing, just because the emergency expires doesn't mean that everything is fine. That person still might be sick. So just, Representative Albright, are you, I brought you up here purposely as a conscious effort to get this to be agreeable to both sides of the street in the best way, and I value your input on here. Are you comfortable? Do you think that we have an issue with how we're saying the words here about governor or commissioner being allowed to suspend things? And is that a real issue to anybody who knows this topic very well?
Mr. Chair and members, I can only speak for myself. I come here representing my own opinion and not that of either caucus in the House. From my perspective, I would have concerns with relevance to a number of the issues that have already been raised by members of your committee, and with regard to the timing of this in consideration of a larger investment in our healthcare system that is currently underway. My concern is shared by a number on this table that we ought not to rush to a consideration of an expansion of powers without due diligence and without careful consideration of the ramifications that they might entail as we walk through this crisis together. And I'll leave it at that.
All right. Well, I value your opinion. I've known you a long time. My concern about not doing this in a way that's quick is that it's going to be 5 weeks, and some of the people who are not in places are going to die. And that's greatly on my mind. And so that's why we're all here looking, giving our best due diligence. Okay, and so where'd Senator Hoffman go? You want to see magic? Senator Hoffman makes actually, I'm going to make an oral amendment to strike 253. Actually, Senator Ingebrigtsen moves to strike 253D. Line 2.3, strike 253D. That's not necessary, and good catch there, Senator. Everybody understand that amendment? All in favor say aye. Aye. Opposed? Little cleanup.
Thank you, Mr. Chair.
Yeah. Thanks, Representative.
I appreciate that, and I also appreciate the conversation that's been going on here with regards to a date certain when this thing is, you know, whatever everybody talks about plateaus and we're on our way down or whenever. Should we not be at least a little bit concerned about when those, you know, when this particular power that's listed ends? Should we just leave that up to the chairs to make a good decision on that, or, I mean, the committee, or, I mean, what's your thoughts on that? I mean, you can't, and I understand you can't put a date down because we can't strap that. I mean, we just can't strap their arms on that.
Well, there is a time certain here. The emergency is declared. This authority is granted, and that authority expires 60 days after the termination on line 1.14. And so, given the non-flexible nature of the areas that we oversee, that's actually kind of short. And so what we're giving the commissioner here is actually what we've wanted forever is, could you be more flexible? Could you help them? This rule's kind of not so necessary right now. Could you look at this ratio? Could you look at this background study? You just did it last year for the person. They're still the same person. They did fingerprints. We still have to do a new one before they can take a job across the street. So I think it's prudent, and I think that's why we're having the hearing now. At least there's some due process of this. So anyway, Senator Hoffman.
Thank you, Mr. Chair, and I'm glad you're having it because this conversation isn't happening in the greater public interest. It's happening here. We're raising issue to this because it's affecting those that are going to be in most need of our services. And I like what you're bringing up. That well, what if? What are we not allowing the commissioner to do in order to just let her staff do her job accordingly, right? And granted, there's probably issues like under CCAP, if you're gone for 25 days, then that child, there's a disenrollment or something going on there. How do you waive? Is it federal with the state? But at least we're leveling the playing field on the state level to do it. And I like what Senator Kiffmeyer was over here smiling, because when she brought up about, well, yeah, the day program staff, why couldn't they go work in a group home, or why couldn't they do that, right? Well, let's look at waiving that. That absolutely makes sense to me, and I think this is the right conversation. And again, I thank you for bringing this as a priority, Senator Abler and the Commissioner. Whatever you need, we're here.
So, Ms. Norton, can I drag you back down here a second? Senator Kiffmeyer, are you comfortable with this?
Well, Mr. Chair, when you're in these kind of situations, it's hard for comfort to be used in this context. Yeah. But I do see this as an urgent need to do this. I've noticed, I appreciate Commissioner Harpstead and you're working with CMS and Medicaid and seeking flexibility from them. I've noticed some of the issues with testing has been resolved by loosening up the FDA and a variety of other things to enable our private sector companies to use their extensive knowledge and abilities to bring to bear the need right now, and we need to do the same thing here in Minnesota. I think some of the guidelines, parameters, reports, exactly what did you do, what was some of that, I think are a very important component of that, but I think we need to do that here as well. And so, providing we have some of those guidelines around it, nonetheless, we're in one of these unique circumstances that I don't think you can say, except in hindsight, whether all that was there. We don't have the benefit of that. We have only looking forward. So with this kind of language of the reporting and information, it's really going to be up to Commissioner Harpstead, a lot of judgment on your part and managing and communication and information, you and your staff, and how this is done. A lot of this is going to be vested in that with you as well.
Thank you. Commissioner.
I'm certainly not going to sit there at my desk and make all these decisions. So I have 7,300 fabulous people behind me who know these services and know where the flexibility is needed. They've all been answering the phones for the last several days and are going to come forward tonight, especially with the things that they think are most needed urgently as quickly as possible. We've also promised to stay in touch with the chairs of the Health and Human Services committees, and not just to say, here's the decisions we've made, hope you like them, but we're going to be in conversation about the kinds of decisions we should make, the kinds of things we shouldn't make, and kind of sort of categorize the things that we feel are really urgent and bring people into that conversation. So we'll have lots of people around us deciding what's best for people in Minnesota.
And Commissioner, I think this is a unique piece of legislation that it does really create a partnership. And I think that's a good thing. And I took the extraordinary step of bringing one of my former colleagues down to have him have input here at a Senate table, because I think it's that extraordinary. And so actually, I just want to make sure before we move this out that I want to hear from Ms. Norton. What do you think about this? Do you see this as a way that's going to make a difference for the things you express concern about?
Mr. Chair, members of the committee, absolutely. What we need is just flexibility to work together. We all care about the people that we support. I've worked at RISE for almost 42 years and never encountered anything like this. So I know today at RISE, we're working with 6 different residential providers to set up agreements to have our staff go work in the homes, which is what Senator Kiffmeyer was referring to. We already are working toward that. We just need a little bit of regulatory relief to make that happen. So we all want the same thing in a difficult time.
Senator Ingebrigtsen, any concerns you have about this?
I do not, Mr. Chair. In fact, I've said this time and again before I came onto this committee, is that these are the people that we should be taking care of. Yeah. And I appreciate the fact you're bringing it forward and addressing that, because it to me is one of the functions I think that we should be funding.
Thank you. Senator Utke, any concerns?
Thank you, Mr. Chair. No concerns, but as I'm sitting here thinking that we maybe can learn a bunch from what we're going through now to untie the hands going forward on some of these issues that we keep saying that we've overregulated and stuff. Due to this crisis, we're going to get a chance to really see how some of these things can work. And I think in the end, when we get the report back, hopefully we can move it forward and do some good things.
I'm kind of interested to see what things that they waived that really didn't matter anyway. So that'd be kind of an interesting department bill. Senator Ralph, any concerns?
I've had some things going through my mind, but so far it seems like the commissioner has done a very good job in anticipating that and working with the Department of Health. I think that that's where the coordination needs to take place. There's regulations out of the Department of Health that I think we also need to be aware of, that the emergency powers granted here would need to be looked at. So I'm very glad that we're taking a broad look at this, but at the same time putting some guardrails on it so that we don't get ourselves into unintended consequences. And I have to echo what Senator Utke says. This is a situation where a battle plan is out there and the first shot's fired, it goes out the door, and you have to be able to make some adjustments. And I think as we go forward, giving the commanders in the field the opportunity to do that is very important.
Thanks. I guess I'm polling all the members. Senator Hoffman, any concerns?
Senator Abler, since last week and bringing it forward, I want to thank you for taking lead on this and pulling everybody together to get something that's appropriate. And I have lots of concerns, but
I mean about this remedy.
I absolutely don't have any concerns for this remedy. As long as we're able to give flexibility for the department to be able to be flexible to the providers out there, just to assure that people are safe and we're doing what we need to do, I'm absolutely okay with this.
Senator Jensen, not to leave you out, any concerns about this remedy? As one who specializes in remedies.
Mr. Chair, I'm satisfied. Thank you.
Thank you very much. I wish we weren't doing this bill. Senator Hoffman renews his motion that Senate File 4200 as amended be recommended to pass and be sent to the Committee on Finance. All in favor say aye. Aye. Opposed? Thank you. Wish you the best. We're still here, we care. We are adjourned only until April. Thank you all.
Thank you.
Mm-hmm.